Hey everybody, welcome back to the Murfreesboro.com podcast. We appreciate you tuning in. As always, we have a wonderful guest with us this week who is, I've been looking forward to this one for a long time. Actually, we've known each other for
long time.
10, yeah.
It's 13 years.
13 years now? God, it's been a minute. So, but let's go through the accolades here. Well, first off, you're a husband and a father. You're a businessman, successful one. You're a doctor. You're an entrepreneur, all the above. And you make men smile all over the country inadvertently. But Dr. Tarola is with us today, and thank you again for joining us. I know it's been a long time coming.
Thank you guys for coming.
Oh, yeah. And in the coolest setting ever. This is our first time in an operating room doing this. This is really cool, you letting us do this. So, but for those tuning in, watching, whatever, that don't know who you are, you're a plastic surgeon, but give us your background real quick.
So I'm a board certified plastic surgeon from Pennsylvania. I did most of my schooling there in Philadelphia, medical school at Thomas Jefferson University, 6 years of general surgery at that same institution. Then the reason we came down here to Tennessee was to do my plastic surgery training, which was 2 years at Vanderbilt.
Well, you can't get better than Vanderbilt. So,
right,
yeah.
right. Top 10. So
that's right.
And then, my wife and I, Adrienne, discussed what we were going to do. Yeah. And she said we were going to stay here. So we stayed here.
Okay, there you go. Yeah.
We're both from Pennsylvania. So I opened my own practice 13, almost 14 years ago. And it's been going great ever since.
Yeah.
A lot of work, but going great.
Oh, yeah, yeah. And there's some things we'll get to here in a minute. But, you're known, are you world known now? I mean, I know you're known across the country for what you do.
Well, I have patients come from, all over the country, mostly from Tennessee and the immediately surrounding states.
Okay.
But most patients travel in at a distance for those patients suffering from breast implant illness. So they're coming in to have their implants removed and breast, reconstructed to some degree with those implants being removed.
Okay. So. Yeah, we'll definitely get into that because I want to talk more about that. But let's take it back a little bit. So how did you and the missus meet back in Pennsylvania, right?
She's a couple years behind me. Mm-hmm. So in between college and med school, I had a year off, and we both worked at the same restaurant. And
there you go. Wait, you worked at a restaurant? I never knew that.
I did,
Were you a server?
I was. No. I was not a good server. My wife was a phenomenal server, but as you can imagine, I was not too good.
Oh, that's so funny. Because I served tables in college, too. I didn't know that.
Yeah.
Hey, we're bonding.
Yeah.
I get it. So,
and bartending.
Yeah, I was a cocktail server at the time. So anyways, so you met at serving tables.
Yep.
Okay, and then did you both go to the same college, you said? Or?
No.
Okay, gotcha.
Different colleges.
Okay.
Different years.
Gotcha. Oh, that's right. You just said she was a couple behind you. So you moved here.
Yep.
To do Vanderbilt. To go to Vanderbilt.
Right.
Okay, gotcha. Why plastic surgery?
Oh man. So in high school, I was fortunate enough to follow surgeons from all specialties. Since I was this high, I wanted to be a doctor, and then I slowly figured out that I wanted to be a surgeon. So I tried to narrow down the field in which I wanted to go.
So there was no deviating. You always wanted to be a doctor?
Since as long as I can remember.
Really? Oh, that's cool. Okay.
So plastic surgery was the last specialty that I had followed or shadowed a surgeon in that. And the surgery that I walked in on was a facial reconstruction from a guy that had been hit in the face with a baseball bat. And so they were putting his face back together. And I thought, of course, that was the coolest thing to see.
Really?
And it just kind of went from there.
You didn't have, there's no jitters I know if I walked in on that, you know how my reaction would have been. I would have passed out, but different story another day. But
no, I couldn't get enough of it.
Really?
Yeah.
Dang. Oh, so you're that special breed that can look at that and just, you see the reconstruction, you start going with it. So that's really cool, man. Yes. Oh, nice. Did you ever want to be a different kind of doctor? Or just...
there was a time that first year or two in residency, which is, extremely difficult. I had thought about going into orthopedics.
Oh, did you? Okay.
But changed my mind back to what I had dreamed out.
I guess. Well, I might be jumping ahead here, but the plastic surgery side, that's got to be extremely rewarding. Meaning, you're changing people's lives. Some of them.
There's so much in plastic surgery too that you can focus your practice on. It from pediatric plastic surgery, craniofacial reconstruction, hand surgery, microsurgery, all the different kinds of reconstructive surgery, or just cosmetic surgery, like I've now focused my practice on.
Okay.
So, there's a lot to choose from.
Yeah. So that's your main focus now?
Is cosmetic surgery.
Okay.
Yeah.
Now, when you first got into it many, many years ago, like what were people coming to you for? Because we know what you're known for now, which we'll get to in a minute. But like, were you just across the board, or?
Yes, across the board. Mainly breast reconstruction, but other things in reconstruction would be skin cancers. Dermatologists would send patients to us after they removed a lesion to put everything back together. Breast reductions are another big insurance case.
Okay.
So,
Gotcha.
Without taking insurance now, all those surgeries are no longer for me, but the cosmetic surgery, I mainly focus on neck down. So breast surgery, tummy tuck, liposuction, skin removal surgery after weight loss.
Okay.
But then also facial surgery. So facelifts, eyelid surgery, etc.
Yeah. So you just do it all.
Pretty much.
You do anything on the feet? Is it everything with the feet?
Nothing with the feet.
You're like, no, I'm good. Well, that's what a podiatrist is for, right? So that's okay, cool. I got you. But I'm going back a little bit again. So the first practice, that was over by the hospital, right?
Yeah, my first office I opened up right after finishing at Vanderbilt. It was in the DePaul building at the hospital here in town. So I was there for 7 years, and then decided to build this.
Was that nerve-wracking at all? Like going in?
Yeah,
like,
of course. Every stage of life is nerve-wracking. Going into college that first year, med school, it's all nerve-wracking. But I have a good wife behind me, and she helped me all the way, especially at the beginning, getting started.
Yeah. Behind every man's a woman rolling her eyes, right? Right, Jen? See, my better half for those watching is behind the camera, so she's helping us out today. Thank you, Jen. Love you. But I love your wife. She's always fun to talk to. She's a trip every time. But okay, so we go from that to DePaul, and then did you come straight here, or you were built here?
Yeah, I built here. So at the end of those 7 years, is when I decided to do this. But construction here took about a year, so I had a temporary office here in town before coming over.
Gotcha. Okay, and you've been here a few years now.
It's since I think March or April of 2019.
Yeah, so several years. Okay, I got. And you have a prime spot over here too. This is a great location.
Yeah, I think it's very visible from Memorial. Yet patient parking behind the building makes it very private.
Yeah.
Too.
Oh yeah,
so
that's
I think
awesome.
It's great.
Yeah. Speaking of the building, so this is, obviously we're in the building. You have your own operating room. So you don't have to go.
I don't go anywhere anymore.
Yeah, right.
I used to have to go to the hospital, to the surgery center.
Nice.
And we'll do that for select patients that we don't think are healthy enough to have surgery here.
Gotcha.
Those higher risk patients.
Okay.
But that's pretty seldom.
Okay. What would be a higher risk patient?
Someone that may have some underlying comorbidity, a heart condition, or
Okay, makes sense. So like somebody that needs a little more attention if you have to put them under type thing.
Right.
Okay, makes sense.
More observation from anesthesia in a more controlled setting, closer to the hospital.
Yeah.
Anticipating some issue arising.
Understood. Gotcha. Okay. So how many operations you doing here in a given year?
In a year?
Or how about a month? Is that easier?
Well, we'll go by day. So
go by day.
I operate about 3 days a week.
Okay.
And the number of cases depends on how long each of those surgeries is. So anywhere between 2 longer surgeries and 4 shorter surgeries a day.
Dang, okay. You're moving. Dang.
Yeah.
Okay. What would be a longer surgery? Is that like 4 hours? Or
Yeah,
more?
we can do up to 4 hours of surgery in an office-based OR like this. So that would be, a facelift.
Okay.
Takes about 3.5, 4 hours.
Oh, dang.
Or like a mommy makeover, a combination of procedures. If you're doing a surgery on the breast, a breast lift with a tummy tuck, that takes about 4 hours.
Okay. Gotcha. Now, speaking of, that's what you have become famous for. Is it the mommy makeover or the breast reduction? I know that's kind of a combination of everything.
Yeah, right? A mommy makeover is just a catch-all term for a combination of procedures. So whatever that individual needs or wants. It could be.
I didn't know that. Okay.
Yeah. So
I thought that was like this particular set.
No, it's not a specific. Procedure.
Okay. Got it. Well, that makes sense. Well, okay. Well, and on that note, then the famous part I keep saying is more. That's the breast reduction, right?
The breast implant removal.
Removal. Sorry.
Yeah.
Yes. Okay.
Yeah,
I'm learning as we go here. So.
Yeah, I have more patients come to me for implant removal with that condition, that breast implant illness condition.
Yeah. So speaking of, we talked a little bit about it off camera one time about the illness. Can we talk a little more about it? Because actually, the person we were in reference to off camera was very interested in hearing about it. So for them.
Yeah. So breast implant illness or systemic symptoms from breast implants, It's a known potential complication of breast implants, and it can be
Okay.
with either saline or silicone implants.
Okay.
Because both are made of silicone shells, so you're getting silicone in your
Gotcha.
body either way.
Okay.
It's a condition that we consider to be a diagnosis of exclusion, meaning, they'll have a whole slew of symptoms. They'll hopefully go be evaluated first for those by their primary care doc or a specialist
Gotcha.
to see if there's some diagnosable condition that would explain their symptoms.
Okay.
And if all of those tests are coming back negative and they're still left suffering, then we think that the implants may be their source of problem.
Got it.
And so then we talk to them about potentially removing their implants
Okay.
in hopes of improvement.
Gotcha. Okay. Man, so much to it. I would never make it as a doctor. Oh my God. I mean, geez, this amount of info you guys got to learn. Oh my gosh. But, I'm curious on one thing. Jen and I were talking about this. I'm going to ask him. So no, I'm just curious. Like, you ever have, you've said before that sometimes people come to you to get something corrected,
Right.
for something. You ever have somebody come in and you're just like, oh my God, what happened? And then
Actually, it's funny enough you asked. I had a young woman come in yesterday for a consultation, mid-late 20s. She had 4 previous breast surgeries
Okay.
in Colorado. So she went in initially for an augmentation and suffered some incision healing or wound healing problems where they just kind of opened up here and there.
Oh, no.
And she was left with horrible scarring.
Oh. Ooh.
And so that was, the surgeon tried to correct it 3 more times, and each time the same problem happened. And the surgeon wasn't able to figure out what was going on,
no.
why she wasn't healing appropriately.
Yeah.
And even in our conversation yesterday, I still don't really know.
No way.
But in this case, I'm going to try to get her records, her operative reports, and see if there's something that would explain that. But sometimes
man.
you can't explain why you do the same procedure for everybody. You put the same sutures in, and some people just don't heal as well as other people do. And sometimes you can explain. It could be that the patient is a nicotine user and wasn't forthcoming with that. But sometimes
gotcha.
you really just can't figure out
Yeah.
the underlying cause.
Okay.
So yeah, I mean that kind of stuff happens every now and then.
Okay. I was just curious. Well, we were brainstorming off camera. And we're like, I wonder what kind of crazy stories he's got with that. but you had mentioned nicotine. Does that play a role in the surgery? Or
Yeah,
people
that's a
smoke or
big
not? Or?
risk factor. So
Is it?
we try to get people to stop smoking at least 3 to 4 weeks before,
Okay.
or using any form of nicotine. So now you're thinking about vaping, because those vaping cartridges have nicotine in it typically. But nicotine's a vasoconstrictor, so it clamps down the little blood vessels that
Okay.
are in the tissue and the skin, and you need blood flow to heal.
Oh,
so if you're
okay.
compromising it with that, nicotine's a very known high risk factor.
Yeah. Okay. Man, learn something new every day. This is going to be informative. We're going to plastic surgery 101 over here. I'm digging it. I'm digging it. So, all right. So like with all the procedures you've done over the years, do you have a favorite or one that you like to just do more than others? Or?
Yeah, it's actually taking care of those
Oh, it is?
illness patients.
Yeah.
So when we're taking the implant out, oftentimes the breast has to be reshaped, reconstructed. So it's very rewarding, number one, taking care of those patients, and those patients that were truly suffering from that condition coming back improved.
There you
And
go.
sometimes significantly. So they're different people.
Yeah.
Sometimes they'll come back with family members, spouses who
Yeah.
also say, thank you for giving me our wife back, our mom back,
Oh, that's
because they just
cool.
feel so much better.
Yeah.
So that's probably the most rewarding part. But from a surgeon standpoint, a technical standpoint, I just also enjoy those surgeries.
Yeah. I got you. Ooh, man. Yeah, I can't imagine how that's just got to make you feel so good. Like you said, a husband or a kid or wife, somebody just like, hey, we got him back. That's so nice.
Yeah, they
But-
see their mom or their wife suffering on it's a daily basis.
Yeah.
From the time they wake up to the time
man.
they go to sleep.
Yeah.
So yeah, that's significant.
I got you. Well, we had talked about this once a long time ago because I think it was something that involved a little boy. But when it comes to like plastic surgery on kids,
Yeah.
right? I think this was one you had told me a kid was bullied or something about his ears or something like that, right? And then so like, where does that line come into play with kids? Because I know they can't when they're 18 and younger. Something was the rule. I don't remember.
Well, the rule here at this facility
Okay.
and similar facilities
Yeah.
set by the state, we can't operate on anybody younger than 14.
14. Okay, I got you. I couldn't remember
But
the age.
obviously we can do pediatric surgery in,
Yeah,
in
yeah,
a surgery center or hospital at any age.
Yeah.
But here, yeah, it's 14. So
14,
a
okay.
common procedure that we would do for someone that young would be an otoplasty or an ear pinning surgery.
Oh, is that what
for,
that is? Oh,
yeah, for
okay,
someone with
gotcha.
a prominent ear that sticks out.
Gotcha. Okay.
Yeah.
Yeah, because I remember we talked about that, and you said that the kid, he was born that way, and you, what's it called again?
It's otoplasty.
Otoplasty. See, I would never be a doctor. My God, I would fail miserably. Okay, and also what that did for him, I can imagine.
Yeah.
Confidence feels good. I mean, man, see, maybe I'll go back to school. Learn how. No, I would never make it. Your job's got to be just so rewarding. My God, it's amazing. So, but anyways, so moving forward, where do you see yourself going? Just more here, more surgeries, more. Are you going to be doing different stuff here, or?
Well, you're always trying to grow and expand, right?
Yeah.
But more of the same, taking
Yeah.
care of this, the same kind of patients
Yeah.
and doing the same thing. We're just adding providers and just growing.
Yeah, because you got a great team here already,
Yeah.
and so the whole building, the staff outside of the surgeries, you do Botox and all kinds of stuff too, right?
Yeah. So the non-surgical side is pretty wide. So we have an esthetician that does the typical services, facials, dermaplaning, lash work, and then our other provider, who's a nurse practitioner and does injections. We do Botox and similar botulinum toxins, fillers like Juvederm,
Yeah.
laser procedures, laser tattoo removal, hair removal.
I didn't know you did that.
Radio frequency microneedling and others.
Yeah.
So
And
there's a lot.
others. List goes on.
Cool sculpting would be one where
Oh, that's right.
non-surgical fat reduction.
Got it. So I've heard on the tattoo removal, I've heard that's kind of painful. Is that how?
It can be painful. It's
Yeah.
sometimes more painful than getting the tattoo. It's certainly more expensive. But we
yeah.
have a device called a chiller,
Okay.
which is a refrigerant that shoots cold air. It's a blast of cold air on the tattoo on the site
Okay.
that we're doing the laser tattoo removal. So that helps significantly.
Okay. So it's a little laser that does it. So it's not
The laser
Yeah.
is the one that blasts the ink apart.
Okay.
And then the chiller
Gotcha.
is thrown on there to help cool the area so that, the laser is an intense amount of heat.
Oh,
so
okay.
the chiller helps offset
Gotcha.
that.
Gotcha. Okay. And you do hair removal here? I didn't know that.
Yeah.
Dang. How did I not know that one? Okay.
Yeah.
I had that done years ago.
Oh, did you?
And I found out they didn't tell me that I was supposed to do the maintenance sessions. So it was like every 3 weeks I would go do it, and it worked great for like 6 or 8 months.
Right.
And then all of a sudden it started growing back. And I'm
Yeah.
like, the hell's this? Damn it, no.
Yeah, the
But,
initial removal is
yeah.
more intense, every 6 weeks apart or so,
Yeah.
and then every several months.
Yeah.
Or
Oh, I remember because we started with my neck, and then we ended up moving down, doing this, down to about like my belly button area up. And I remember the lady says, "Oh, it's like taking a rubber band and snapping like that." And I'm like, "Well, I could live with that." Oh no, that was. Well, then she said like the darker the hair follicle, I guess.
Yeah.
Oh my God, I thought somebody was stabbing me with a needle the whole time. That sucker. Woo! But the after effect was awesome.
Yeah.
Didn't have to
And
shave for months.
There's different lasers for hair removal.
Okay.
Some more painful than others. So
I gotcha.
We have one that's not quite as
See,
painful.
I had the painful one. She knows who she's right there. No, yeah, I just remember I was like, oh God, but that I would do it again for the
Yeah.
not having to do all that for a month. It was great,
Yeah.
so I'm curious on you ever have anybody come in asking for something like crazy off the wall? Like you see this stuff on TV where people are like, hey, put a third eye in my head or something. You know what I'm talking? Something weird. Like you ever anything like that?
Every now and then, but I think my staff filters that out on the phone calls coming in, so I may not hear about all the ones
Yeah.
that call in.
Jen, we need to stage it one day. Like, excuse me, does he do men? I need a penis extension, please.
We've gotten those phone calls.
Have you really? You refer them out to another doctor. Get out of Vanderbilt. Sorry. Sorry. No, I'll lay off that one. But anyway, so well, cool. Well, I really appreciate your time, and I know your time is very valuable today, and you got to run, so thank you for that. But closing remarks, anything you want to push out there to anybody? Anything you want to say?
Nothing special.
Nothing special?
No, it was good talking to you.
Oh, you too. Thank you very much. And we'll put all your information in the description of the video. So if anybody wants any of your services, you can check out the website. You can call them up here. You can come to your facility. Talk to the lady up front. She's super nice. So,
Absolutely.
But yeah. So there you go. Again, appreciate your time. For everybody who's watching and listening, we'll see you on the next one.